I think it's been such an honor to be involved with this program. When I came to Boca Community Hospital in 1993, I hadn't been here but a couple of weeks, and I was invited to a meeting with a group of people in the organization, and they wanted to talk about what we could do to help our community. We just received the results of our community needs assessment, and there was a glaring need there. And I was new, I didn't know all the politics, and we're looking at all the pieces, and somebody said, well, what if we put some nurses in the schools? And at the time, people were looking at it and they said, well, let's put LPNs in the schools. And I'm an RN, and my heart is with RNs. And I said, no, absolutely not. You can't put LPNs in the school. We have to have RNs in the school. We need people who can assess these children and their families, and we need people who can work and develop plans to make it better. We weren't going to be the Band-Aid people out there. We were really going to make a difference. And we went through that whole process, and we had to go to the board to get approval for the funding, and we had to get support from administration, and we had to hire nurses. And there weren't a lot of school nurses in the state of Florida. Actually, the only nurses there were with the Department of Health, and like Gary said, they all had 4 and 5 schools. So they were used to a model where they were responsible for 9,000 kids, but nobody had a model in Florida.